أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقهوا قولي. So today inshallah we shall be talking about emergency medical services, and remember our course is all about the hospital support services. So we've been talking about the support services that the hospital normally offer. And one of the support services is the emergency medical services. So these are the lesson contents and objective. By the end of the lesson, you should be able to, number one, identify and explain the components of emergency medical services, describe the aims of the emergency department, outline the primary functions of the emergency department, discuss the various duties of staff members in emergency services, then differentiate between the types of emergency services, conduct a departmental analysis of emergency services, then lastly, identify and analyze the crises and challenges faced in the emergency department. Okay. In the introduction, they're telling us that medical emergencies occur when a patient requires immediate, high quality medical attention to prevent loss of life or serious injury, often resulting from unexpected events like injuries, infections, or chronic neglect. For example, diabetes. So when we are talking about medical emergency, it is when a patient requires an immediate attention, an immediate high quality attention. Why? So as to prevent loss of life or serious injury. So for example, somebody is in class and he abruptly faints or something happens to somebody in class. So the class members, they're supposed to react quickly, do some first aids, then later call the emergency services. So emergency medical services aim to do what? To quickly assess, intervene, and transport patients to appropriate healthcare facilities, enhancing survival and minimizing disability. So these emergency medical services, they aim to quickly assess. So when they come, the first thing, they'll assess your condition, and then they will intervene. Intervene means they take the necessary precautions and the necessary measures. And then lastly, they will transport you through an ambulance to an appropriate healthcare facility. And this will help or enhance survival. If you call them, for example, and they come early, so we will be helping a life and at the same time minimizing disability. So effective emergency services require innovative public health planning to address the diverse needs of different community contexts and dispel misconception that they serve only low-income groups. So the effective emergency services require innovative approaches to health planning to address the diverse needs of our communities. Our communities, they have diverse needs, and we also have to dispel misconception that they serve only low-income group. Okay, so we have to dispel misconception that they serve only low-income groups. So the emergency medical services, they give services to all, not only those people who don't have money, for example. No. Now, what are the components of emergency services? Effective emergency services rely on several essential components. Number one, emergency care. So this refers to the medical assistance provided during the initial hours. So for example, there is an accident somewhere. So when you're talking about emergency care, we are talking about the services, the help that the patient or the person who is suffering gets during the initial hours. Initial hours is just immediately after the accident, of serious complications, injuries, or acute medical condition. Number two, paramedical personnel. These are healthcare workers involved in the transportation and care of patients during emergency. You normally have the ambulances that normally give these services. So the people who normally work there, they are known as paramedical personnel. So they're involved in the transportation and the care of patients during the emergency. And one thing, their training levels vary. So you will always find them inside that ambulance. They are not the same. So their training levels varies, ranging from highly skilled professional capable of advanced life support to those with basic first aid knowledge. So if you go inside an ambulance, for example, you will find that you have specialists, people who have specialized, but we have people who just have the basic knowledge. Then number 3 is the triage. And what is the triage? This is very important. Triage is the process of assessing and prioritizing patients based on the urgency of their treatment needs, especially in situations with multiple casualties. And patients are categorized into 3 groups: those unlikely to survive, those who can recover without emergency services, and those who require immediate emergency care. So let us take an example. Maybe there is an accident. So when there is an accident, we need to assess the situations and prioritize it. During an accident, some cases are very serious, some cases are serious, some cases are not serious. So you, as a medical practitioner or as a paramedical, you need to start with the high priority areas. And they say that people are normally categorized into 3 groups. Those unlikely to survive. There are some people who they have limited chances of surviving, like 1%. So even if we focus on them, they'll just die. Then there are those who can recover without emergency service. During an accident, there are some people who can walk on their own, so they can recover without the emergency services. And those who require immediate emergency care. Then there are those who require urgent and immediate care immediately after the accident. So these ones are the ones who are supposed to be at top of the list. And that is why they're telling us, with the latter being the highest priority. The latter means the last one. The last one is the people who are what? Those who require immediate urgency care. Then number 4, we have emergency medical systems. So the EMS addresses various medical emergencies, including communicable and non-communicable diseases, obstetric issues, and injuries. It encompasses on-site management, transportation, and care at health facilities. So the emergency medical system, this is a system that enhances, or a system that helps us as medical practitioners or as paramedical personnel when we are dealing with emergency care. For example, when we are on site, how should we behave? The transportation, how should it happen? Who is going to provide the transportation? Then the care, even after you've been transported, when you arrive at the hospital, then who is responsible? So these are some of the components of. Now, aims of the emergency department. So when we are talking about the aims of, when you are talking about the aims of, let me just take the attendance. There are only 3 students. Let me take the attendance now. There are some students, they'll just come late. So I've already taken the attendance. Those who will come late, they'll just be absent. So when you're talking about the aims of the emergency department, we are basically talking about the objectives of this emergency department. So number 1 is to offer the right treatment. That is ensuring appropriate medical intervention. So that is number one. We need those people who are suffering to get the right kind of treatment. Number two, providing timely care to patients. Then they are receiving the medical intervention at the right time. Because, for example, if we are late at giving the service, and that is why you find sometimes there is an accident, but the ambulances, they come late. So when the ambulances come late, maybe some people will be dead by then, or maybe their condition will have worsened by then. The right place, administering care in the suitable environment, we have to ensure that the emergencies, for example, if it's an accident, we have to ensure that we remove the people who are suffering, who have been injured, and we give them treatment in a very safe, suitable environment. Right resources, utilizing necessary medical supplies and personnel. We have to ensure that we have enough of the supplies and we have experienced personnel. Speed, this is very important. Responding quickly to emergencies. And this is related to the right time. Because if you don't respond urgently with speed, you are going to miss a lot. People are going to suffer. Then sympathy, arif and rahma, offering compassionate care and support. So people who are giving emergency services, they have to have an element of empathy, a rahma or arif. They should be soft because those people, normally they're really suffering. So you should be caring. Then science, applying evidence-based medical practices. When we are giving the medical services, we have to ensure that the practice, we are applying or using the best practices, scientific practices that is based on data, based on information, and it is objective. Now, what are the function of the emergency department? So there can be 4 functions of the emergency department. Number one is delivering immediate and effective life-saving services to patients at any time. So the keywords are immediate. Remember, when you're talking about immediate, speed and time, and it should be effective, which is related to what? Right treatment. Then number 2, rapidly implementing basic life support for critically ill patients, both on-site and during transport. We should be rapidly. Rapidly means we should be reacting quickly when we are giving the services, both on-site. For example, if there is a disaster or there is a flood or anything, based on site, and also during transport, when you are traveling, when you are carrying the patients using an ambulance. Inside the ambulance, we should still be doing what? We should still be giving them the necessary precautions, the necessary care. Then assisting individuals in need of medical treatment. Then lastly, providing effective care and management during disaster situations. Now, category of patients in emergency care services. This is, we had already highlighted this before. So patients are classified based on the severity of their condition into 4 categories. So during any kind of emergency, normally cases are classified into 4, or patients are classified into 4. Number 1, we have emergency cases. Cases needing immediate examination and treatment, such as severe injuries or traumatic illnesses. So immediately after the accident, there are cases that are emergent. We need to deal with them. Number 2, we have urgent. These are cases like stomach pain or headache that require prompt attention but are not life-threatening. Yes, they are urgent, but they are not life-threatening. That is, you're not going to die because of stomach pain, or you're not going to die because of headache, but yes, it is still urgent. Then number 3, we normally have staff and employees, cases involving hospital staff. Sometimes during the accidents, sometimes even the staffs and employees, they are affected by the cases. Then non-emergency. Minor cases referred by physician, not requiring urgent care. So sometimes after the accident maybe, or after a disaster, there are some cases really that don't do what? That don't require the immediate attention. So we can just refer our patients to physicians. Now, what are the duties of staff in emergency services? In any hospital, you normally have the what? In any hospital, you normally have the emergency department. And the emergency department, it has staffs who are working there. So what are the roles of each and every staff in the emergency department? So number one, there is this staff. There is the department chief medical officer in charge. So what is his work? His work is to check punctuality of medical officers and resident doctors. So he takes the al-hudur, the attendance, prepares duty roster for doctors. He prepares duty roster is a timetable or a schedule for doctors, conducts supervisory rounds of equipment and drugs. Amaliyatul Ishraf, they normally supervise to see that the equipment at the emergency department is enough and the drug is enough. Oversees registers and documents, then supervises sanitation and what? And biomedical waste management. How are they managing waste in that department? Then they're responsible for training and reorganization classes. They are responsible for training all the staff and official in the emergency department. So that is number one. Number two, we have the senior resident. So the senior residents examines and treat patients promptly. If you go to an emergency department, their work is to treat patients. Then number two, satisfied death certificates and obtained counter signature. So for example, in the emergency department, if somebody dies, they are the ones who are going to certify the death certificate. And they have to sign. Without their signature, the body cannot be given to the family. The body cannot be taken anywhere without their signature. Then we have the junior resident. They carry out treatment as directed by senior. They are directed by the senior staff. They take rounds with senior residents and performs minor operation. They can do minor operation and they document case details. Also in the emergency department, you will find the specialists. So what is their work? Work on regular duty or on call. So these ones, they work on regular or call. They are not permanent in the emergency department. So that means they only come when they are needed, when they are called. And their work is to document notes in case sheets when consulted. So when we call them, when you consult them, they document the cases. They provide expert guidance and supervises subordinate staff. Then they can also train junior doctors in emergency case handling. Then we have the DNS or ANS. Sometimes they are called sister in charge. Or in some countries, they are called nurses in charge. You'll also find them in this emergency department. So they ensure efficient functioning of the emergency department. Sometimes they also prepare the duty schedule timetable. They also store essential drugs and ensures equipments are functioning. Then we normally have the nursing staff. They normally execute doctor's orders. They monitor patients' vitals, prepares deceased patients for transfer, assists in patient care and transfer, handles supply requests from the store. Then you also have the housekeeper. They maintain cleanliness of the area, changes soil linens. Linens, remember we said that the patients in the emergency department, they normally use the towels, the clothes they're using, the bed sheets. So it is the work of the housekeeper to be changing them. They transport diseased patients to the mortuary. So sometimes when the deceased patients in the emergency department, they have died, they are the ones who will carry them to the mortuary. And remember, a mortuary is the place where the dead people are kept before their family come to do what? To take them for burial. Then you have the stretcher bearer. The stretcher, from the word stretch, they are positioned near casualty entrance. They are always near the entrance of the emergency department. They assist in transferring patients from ambulances to the emergency department. So they are always waiting. Their work is immediately the ambulance comes, their work is to carry the patient from the ambulance to the emergency department. That is why they are called stretcher, carrying. Then they are also trained in first aid treatment. They have basic training in what? In first aid. Then we also have the security guards. They normally follow duty roster set by the security officer, regulates patients and attendant flow, how patients move around the emergency department. Then they perform other duties as directed by supervisors. So these are some of the staff you will find in the emergency department and some of their roles. So, and this basically depends, it all depends with the size of the hospital. In some big hospital, the number will be that whatever much, but in some hospital, small hospitals, you will not have many staff. So it depends on the size of the hospital. Now on to the next point, types of emergency services. So number one, we have sorry, this was an error. So we have major emergency and disaster management. That is the first type of emergency service. So this type encompasses the response to, the key word is what? Large scale emergencies or disasters that can result in significant casualties or injuries. So the major emergency, it deals with large scale emergency. Maybe, for example, there is an earthquake in a place. So that is a major emergency. Another major emergency, maybe it has been raining for long and there is flood. So people need to be helped from the flood. That's a major. Then maybe sometimes there is fire, big fire in a place. That can also be a major emergency. So examples include mass casualties from natural disasters, earthquakes and floods, or during large public events, concert or sporting events, or even campaign. Sometimes we find during the elections, people are in a big stadium, there are very many people, and maybe something happens in the stadium, And even the terrorist attacks can be included here. When you are in a crowded place and then you are attacked, there's some bomb blast. So the focus is on comprehensive strategies to triage patients, provide immediate medical care, and manage resources effectively. So in this major emergency, our focus is to triage patients. Remember, when we were talking about triage patients, we were saying we put the patients according to priorities. Case number 1, very urgent. 2, urgent. 3, not urgent. That is the meaning of triage. So we normally start with the serious cases. Then the cases that are not serious, we put it down in our priority list. So hospitals must have preparedness plans. Hospitals always must have plans for these big disasters or this major emergency. So in place for such scenarios, including training staff, establishing emergency protocol, and coordinating with local and regional emergency management agencies. Number 2, referral emergency. Referral emergency services are involved when patients' cases require specialized care or advanced medical intervention that is not available at the initial care facility. So, for example, we have a patient at Abrar Hospital, but this patient needs to be transferred to Boroma International Airport, sorry, to Boroma International Hospital. Why? Because maybe Abrar is not having the necessary facilities. It is not having specialized doctors. It cannot carry out some tests. So here there is a referral emergency. So this patient, we need to refer him or her immediately. If we don't do that, they will die. So this may include transferring patients to specialized hospital. So sometimes we normally have specialized hospital, for example, trauma centers. You cannot treat a trauma patient in a normal hospital. They need specialized hospital. Burn units, for example, there is a fire. Patients have been burned. You take them to a Abrar hospital. But if the condition is serious, we need to take them to special hospital that can deal with the burn, things related with fire, or cardiac care. So, for example, you take a patient to a general hospital, but you realize that they need a cardiologist. They need to be transferred to a cardiologist center. So that is what is meant by referral. So effective referral system enhance patient outcomes by ensuring that individuals receive appropriate and timely treatment based on their specific medical needs. Then number 3 is basic emergency. So basic emergency services cater to common injuries and health issues that do not require advanced life support or complex intervention. These services often include treatment for minor injuries, illness, and stabilizing patient for further care if necessary. Facilities offering basic emergency services typically focus on quick assessment and basic intervention, making them accessible for non-critical. So when you're talking about basic emergency, they are just like clinic, for example, like Nasir. For example, if in Nasir clinic at Sheikh Ali, so there you can just go for basic emergency. Maybe you have a problem with your stomach, your head, minor injuries. You are playing football, for example, you get some bruises, ila ghairi dhalik. Then standby emergency. So standby emergencies services are organized to provide immediate assistance. The keyword is immediate when required, but do not operate continuously. So standby, they are always there to provide immediate assistance, but they don't operate continuously. They are activated during specific instances, such as public events or when there is a potential risk of emergency. So the standby, for example, there is going to be a campaign, a very big campaign. The presidential candidate is going to come to Boroma, is going to come to a very big field. So this standby emergency, they will call the ambulance. They will just be, there is nothing has happened. They're just standing by because maybe. So standby means if something happened, they are there. And they only operate during special cases, during football matches, during campaigns, ila ghairi dhalik. For example, hospital may have standby provision in place for community events where increased patient flow or potential injuries are anticipated. So if you're having a community event where people are very many, we expect that a lot of people maybe will need some healthcare attention. So staff and equipment are on alert to respond quickly when an emergency arises, ensuring readiness without the need for constant operation. Now, the departmental analysis. The emergency department should focus on the following key factors for effective operation. If the emergency department wants to work effectively, number 1, they should always ensure that they assess the productivity and utilization of their staff. They should ensure that the people who are working in the department, they're very productive, they're not lazy, they're active. Number two, identify necessary clinical and non-clinical skills that they need to possess. Then determine the number of full-time and part-time staff and their duty shift. We need to organize them so that at any given time, we should not find ourselves or we should not have like a gap. Then number two, our treatment rooms. Ensure appropriate space is designated for patient treatment. We should have enough room. Patients, we should monitor the number of patients admitted and their daily treatment routine. Then lastly, minor surgery. Analyze surgery duration and schedule doctors accordingly. So these are some of the key areas that can help the emergency department to be efficient and effective at the same time. Then also material management, you have to review the management, distribution, and transportation of all materials. Ambulance service, tomorrow we shall talk more about the ambulance service. To verify the availability and readiness of ambulance service, we need to always ensure the ambulance are there. We don't want our patients or people are calling us, we need the ambulance. Oh, the ambulance is not there, it is in the garage, the ambulance is this and this. No, the ambulances should always be there. Staff education, we should be training our staff. We should be interviewing and carrying out survey to evaluate staff skills and knowledge. We need to know the gap, what skills they have and what they need to enhance. Then charging procedures. Regularly review the charging system and associated costs. How do we charge our patients? How much are they supposed to pay? إلى غير ذلك. Then lastly is the crises and challenges in the emergency department. So if you go to many hospitals, you'll find that they normally have a lot of challenges, especially in the emergency department. So number one, you'll find it's overcrowded. Too many patients. And too many patients can lead to what? Long waits for inpatient beds. So if there are many patients, they'll have to wait. They will not be having enough beds. Ambulance diversion, if there are too many patients, it also means that our ambulances will be very busy. Errors, we will be having a lot of errors because the more the people, they will be having errors in admission, errors in treatment, adverse outcomes. Number two, sometimes we'll have nurse shortages. Number three, physicians, the doctors, sometimes they are not available. Then number four, uncompensated care. More and more patients show up for these services without the means to pay for it. This creates burden on the taxpayer, whose money government uses to maintain the emergencies. So uncompensated care, you find that more and more patients, they normally go to emergency care, and sometimes they don't have the money to pay. Sometimes the government is forced to pay for them. Because, for example, if you get an accident, so they'll just call the ambulance will take you to the emergency department. And maybe sometimes your case is very serious, you need some surgery, they will do it. Then ask for the money later. Overworked staff, due to constant influx of patients into the emergency wards, the staff is overworked, prone to error and indifference towards patient suffering. So sometimes you find that the workers in the emergency department, they are overworked, and because of that, you will find that they do a lot of errors because their mind is not focused. Their mind is what? There is what is known as al-irhaq al-dhihni, and they'll also have what is known as indifference towards patient suffering. Indifference towards suffering, maybe sometimes they'll have to leave some patients, they'll have to go to some patients, sometimes it can be very tricky. Then lastly, lack of specialized training. So despite being the most essential requirement, the staff is not properly trained with respect to their location to handle the severe cases. As can be seen, a good example is in India, which is one of the countries where they normally have a lot of cases, emergency cases, which is prone to tropical diseases, cardiac complaint. So these are the 6 key challenges that normally face what? That normally faces the hospital department, the emergency department in our hospital. So that is the end of our lesson. If there is any question, you can ask. I've already taken the attendance. There were only 3 students who attended the class early. There was Asia Farah, there was Hassan Nur, and Samia. These are the students who are in class, who came early. The rest of you who came late, then you're absent. So I think we will meet tomorrow, inshallah, we'll meet tomorrow for our next lesson. Next week, you will be having a quiz. That quiz will, so next week we will not be having classes. I'm not sure, but maybe next week you will be having a quiz for your course. Then the other week you might be doing your final exam. So this week might be our last week. Then next week we might do our quiz, and it will be the end of our course. So we'll meet tomorrow, inshallah. Wassalam.